much, Amanda, and it's fantastic to be here this morning. But it is every presenter's worst nightmare to follow up from the ever enigmatic Bernard Salt. So thank you very much for that. And to also present a really snappy highlight of some statistics pertaining particularly here to Meadowbrook, and that they are summarised in the research that Council has undertaken and is in the paper on your table this morning. But as Bernard has highlighted, the health and education sector and the health and social assistance sector is one of the most significant growing sectors in Australia today, and is fundamentally influencing and influenced by our changing demographic, where we are moving to as a nation, and nowhere more so than here in Logan City, where you've got Logan City being Queensland's fourth largest local government area in terms of population and continuing to grow. So our current reality then, in 2016, there were more than 3,000 healthcare and social assistance workers in the area of Meadowbrook, and it's called the SA2, the Statistical Area 2 of Logan Lee, which incorporates Logan Lee and Meadowbrook. More than 40% of the total workers in that area were within the health and social assistance sector. And when we compare how that has grown from sort of 2006, where we had just over 1,550 workers in that sector, and comprising 37% of the total workforce in that same area at that point in time, we've had a doubling of the workforce in that sector in this one area over that 10-year period, and an increasing significance of that share of the workers in that area, in that sector within this area. In 2017, there were 21 businesses that classified themselves or were registered as healthcare and social assistance businesses. That doesn't sound much, but that's only that particular sector, and I'm going to identify a few others that were within the retail, the manufacturing, the community services, education sector that were highly related and highly had very strong relationships with the healthcare and social assistance sector. I'll talk more about these a little bit later. Oh, that doesn't show well on the screen. The Logan Hospital. Let's call it the beating heart here in Meadowbrook. It's at the core of the healthcare role and the healthcare performance of the City of Logan generally, as the city's only hospital. As any healthy heart, it stimulates the energy, the vitality, the activity within Meadowbrook and within the city as it caters for the healthcare needs of the community. It's no mean feat when you're the state's second busiest emergency department. There are more than 88,000 presentations to the emergency department recorded in the 2016-17 financial year, and more than 75,000 patients admitted to the hospital. And the pulses at the core of that heart, more than 2,050 healthcare and administrative professionals working in that hospital. The hospital opened in 1990 as a 48-bed hospital unit and now offers 448 beds. And as already been mentioned this morning, there are current plans to expand that hospital over 3 stages, the first stage of which will add just about 190 odd beds, and then further beds, 143 and 176 in stages. That's significant investment to Logan City, to Meadowbrook, and to the hospital overall. It's not only, as I mentioned, the hospital in terms of the healthcare workforce and the mix of health and social assistance sectors that are here in Meadowbrook. We've got the UQ Health Clinic, the Logan Heart Centre, Evolve Therapeutic Services. There are collection agencies for radiation, radiology for pathology. There's the sleep clinic, there's aged care beds, the health training here at Griffith University and at the TAFE, which our following speaker will talk in more detail about, and a range of community and health support services such as Anglicare, Southern Queensland's Help at Home Office. And this is just a snapshot of some of the businesses. It's not meant to be completely exclusive to those businesses. And then just briefly, some of the demand fundamentals. We've already talked about that there's significant growth in the population of Logan City overall over the next period of time. We talk about Logan City as basically the primary catchment area, or the primary area for the Logan Hospital and healthcare facilities here in Meadowbrook. In 2017, there are just under 320,600 persons living within the city of Logan. And between 2007 and 2017, that growth in the population was about 170,000 people during that period. Projected by 2036 to be about 490,500 people. Again, another growth of about 170,000 people, or about 9,000 people per annum over that period to 2036. Logan City will continue to be the 4th largest local government area in terms of population in Queensland, behind Brisbane, Gold Coast and Moreton. In particular, between 2017 and 2036, about 20% of the total growth in the Greater Brisbane area will be here within the City of Logan. In terms of some of the, we'll talk about some of the other demand fundamentals. Between 2011 and 2015, the most recent data that we have available, the number of taxpayers in Logan City that reported having private health insurance increased from about 50,000 to about 63,000 people over that period. And what I've got here is a thematic map which illustrates the darker the colour, the higher incidence or the higher number of those taxpayers with health insurance. And you can see in the growth corridors to the south and also to the Rochedale Souths, the Springwoods, those areas in the east, the higher incidence of those with private health and private hospital insurance. The number of children aged 0 to 4 years within the City of Logan will increase by 12,000 children up until 2036. As Bernard's already mentioned, we've got significant growth in that population aged 70 plus. That population aged 70 plus will more than double over the period to 2036, such that we'll just have under 60,000 people aged 70 plus living within the City of Logan. And there'll be an increase of about 25,000 people of women of childbearing age within the City of Logan during that same period. A couple of thematics which talk about a little bit about at-risk factors of the health of the community of the City of Logan. So the first here I've got is the incidence of those of adults who are aged 25 to 64 years and the incidence of diabetes. And then again, the darker the colour, the higher incidence of diabetes. And the red is that area of Logan Lee, Meadowbrook, where we are, that's sort of the red boundary there. The incidence of diabetes for those adults in the City of Logan range from about 3.7 per 100 adults in the Cornubia area, which is a sort of acreage, families establishing younger community, to 8.9 in Logan Central Woodridge. The Australian average is 4.7 and the target rate nationally, I think by about 2020-22, is 4.1. 7 of the 11 sub-regions of the City of Logan were at or above the national average. So some at-risk factors there. Suggests a higher demand for healthcare facilities. And then just briefly, the incidence of those aged 18 plus who are identified as obese or overweight. 4 of the 11 sub-regions in the City of Logan and the surrounding areas were in the highest bracket, where about 70 to 80% of adults were classified again as obese or overweight. And again, it's that darker colour. By 2035, the shortfall will still be in the order of about 585 beds within the City of Logan, without any additional or further hospital or outpatient care added to the area. There are no private hospitals currently within the City of Logan. The hospital here is still the only hospital within the city. The closest private hospitals are the new Mater in Springfield to the west and Sunnybank to the north. By 2020, the shortfall of specialist outpatient consulting rooms is estimated to be in the order of about 370 shortfall of those consulting rooms, and increasing to a shortfall of some 700, a shortfall of those 700 outpatient consulting rooms by 2035, again if there are no additions to the network. More than 2 million additional outpatient service requirements are projected within the City of Logan to 2035, and 100,000 emergency requirements over those sort of the 15-year period 2020 to 2035. In terms of consultation rooms, an additional 100 consultation rooms between 2020 and 2035, and a growth from 476 outpatient room demands in 2020 out to over 820 by 2036. The fastest growth rates for those sort of specialist services in rehabilitation, immunology, infectious diseases, rheumatology, and chemotherapy. That sort of growth of those sort of almost 60,000 people aged 70 plus will require almost 5,000 new aged care beds within the City of Logan. So there's some significant, the growth in outpatient, inpatient demand, and some significant growth in new investment and new facilities required within the City of Logan. Thank you.